Yeah, thank you for mentioning hyperinsulinemia. I think it's very, very important. I think it's Dr. Ben Bigman says, forget everything else. It's the hyperinsulinemia that's leading to all these disastrous sort of conditions. Yeah, and we don't check for insulin levels.
No, we don't, and that's a huge problem.
Mm-hmm. Yeah, huge problem, because I mean, one advantage, and there are no advantages to any diseases. However, it's just my way of making myself feel better. One advantage of being type 1 is that you can see exactly how much insulin you're taking or you're needing every single day. So when I pass my sort of limit, I know something is just, well, I pass for a reason, because I'm overeating, but because the insulin isn't as effective as maybe a few days before. So I know, you know, that's insulin resistance. I've got to do something. So I just fast. Even a short fast, or 24-hour fast, makes a massive difference to me. And I hear from other type 1 diabetics, it does the same to them as well. So we just don't eat, skip a meal or two, and then you just regain your insulin sensitivity. So so it is very important to keep those insulin levels down, right?
Well, and I also think,
for someone who is not diabetic, how do you know if your insulin levels are running high, or is it,
that's a great question. I think it's like you said, they don't test for it, and they can do a fasting insulin test. You can just get it at the doctor, like a blood glucose. It's just a blood test. In my opinion, it should be a routine standard thing at every checkup. The problem is that in a lot of people, just like with glucose, your fasting level of insulin could be normal. But if you eat a meal, especially a higher carb meal, the insulin could go way, way up, and it could stay elevated for most of the day. And you're not going to see that in the fasting test. I think, and there are ways to test for that. I don't recommend doing it, but there are indirect things that will suggest that you have high insulin most of the time. And this is, like I was saying, it's a shame that they don't check for this, because there are so many people with all these unexplained problems. And these problems would absolutely be explained if anyone was looking at insulin. So things like migraines. I don't know if I mentioned I recorded another podcast earlier. I'm like confusing the two, but skin tags, gout, PCOS, non-alcoholic fatty liver. In some people, it's that abdominal obesity, or if you are carrying a lot of weight despite exercising a lot and you think you're doing a healthy diet. There's just so many, joint pain. Well, that can come from a lot of things. There's so many different things that the chronically high insulin does, that again, even if you're not diabetic, even if your blood sugar is normal, but so things to look for that would tell you you might have chronically high insulin, even if you don't actually test for it, would be, I think skin tags, and I keep pointing here because they're very common around the neck area, but not always. Women that have PCOS, that is a high insulin condition, period. There's a skin condition called acanthosis nigricans or nigricans, where the folds of your skin, like your elbows or your knuckles or your neck, the back of your knees, get black or gray, kind of ashy looking. That's one of them. If you, in a normal checkup, if your triglycerides are high and your HDL is low, that kind of ratio looks like chronically high insulin. If you have high blood pressure, essential hypertension, meaning they have no idea what causes it, you probably have this high insulin. Gout also, it just, there's a lot of things that are caused by this or exacerbated by it that can tip you off.